My name's Eve Proper, and 2 weeks before my 36th birthday, 5 years ago, I was diagnosed with Hodgkin's disease, also known as lymphoma, and I had chemotherapy and radiation for a 6-month period. Patient-centred care, to me, literally means the patient being at the centre of their health care, understanding what they've been diagnosed with, understanding what their treatment will be, how they will be treated, who will be treating them, and having as much information and understanding the process and the expression cancer journey as much as possible. When you have patient-centred care, making sure that you're part of a multidisciplinary team and understanding your own experience with cancer and how you're going to be treated, it does show that there are better outcomes for patients. I was part of a multidisciplinary team, so I was aware that everybody who was involved in my cancer and my treatment was knowing what was going on. It actually made me feel more confident in my own treatment at the healthcare system, that everybody knew what was happening, so you don't have to repeat your entire journey to the nurse or the nursing unit manager or the receptionist when you go for radiation oncology, that everybody knows about what was specific to me. Speak to your GP to see if your medical specialist, whether it's your oncologist or haematologist that you're being referred to, is part of a multidisciplinary team at the hospital that you're going to be referred to. When you are told you are diagnosed with cancer and what's going to happen next, that you're told 100% of information but only 10% gets in and you lose the next 90%. So I'm actually a huge advocate that it's really important when you're diagnosed throughout your whole pathway of treatment that you have somebody with you if possible. And it's also important to recognise the role of the carer and the impact that you being diagnosed, whether it's a direct family member or a friend, but the impact it'll have on the carer. I think it is very important that the patient and the carer understand what's going to happen and that they have the possibility and the ability actually to ask questions throughout that. I know now that there are a lot of patient groups on Facebook and a lot of advocacy groups, and I think that's absolutely brilliant for patients to exchange information on their pathway and how they're going and side effects and everything like that. But for your diagnosis, you must go to a medical professional. So first point, if you're feeling unwell with something, you must go to your GP and they will refer you to a medical specialist.